This video addresses these questions. What is end-of-life care? What are some differences between palliative care and hospice care? Where is end-of-life care provided? How is end-of-life care paid for?
Well, end-of-life care is a broad term to describe special support given during the period leading up to death, when the goals of care focus on comfort and quality of life. Research shows that informal caregivers, also known as lay caregivers such as family and friends, typically provide care until a crisis occurs, when the person is then moved to an intensive care unit or a nursing home where the focus may be on life-extending treatments. This norm is not necessarily the best option, depending on the person's wishes. Palliative care and hospice both focus on providing comfort by addressing symptoms, but there are important differences. Palliative care, for example, can be provided along with life-extending treatments, whereas to receive hospice, one must be willing to give up such treatments, as hospice provides only symptom care. Another important difference is that palliative care is available to anyone at any age with a serious illness. You do not have to be dying to receive palliative care. In fact, research shows that patients with hard-to-manage chronic diseases, such as AIDS, cancer, and diabetes, can benefit from palliative care long before their condition might qualify for hospice. End-of-life care can be provided in many places, including the home, the hospital, critical care units, nursing homes, hospice care centers, and even outpatient palliative care clinics. Area agencies on aging can help people find local home care and hospice services, or you can call the Elder Care Locator, a public service of the United States Administration on Aging. To pay for end-of-life care, people rely on a variety of payment sources, including government health insurance programs such as Medicare and Medicaid, private financing options such as long-term care insurance, and personal funds. While our module explores each of these options in detail, we also encourage people to become familiar with how their own state administers Medicaid, as covered benefits for end-of-life services vary from state to state. In terms of planning for how to pay for assistance with activities of daily living such as bathing, dressing, and eating, we point people to the National Clearinghouse for long-term care information. The need for this kind of care can precede the need for end-of-life care by months, if not years.
Remember these points when exploring end-of-life care options. The goals of end-of-life care focus on comfort and quality of life during the period leading up to death. End-of-life care can be provided in many settings, including the home, the hospital, nursing homes, and hospice care centers. Palliative care provides comfort care for serious illness and is available to anyone of any age. Hospice care provides comfort care to a dying person, but does not include attempts to cure the person. The Elder Care Locator at 1-800-677-1116 can provide referrals to local end-of-life care options. Medicare, Medicaid, long-term care insurance, and personal funds are used to pay for end-of-life care. For long-term care information, visit www.longtermcare.gov. To learn more, check out the End-of-Life module at www.nihseniorhealth.gov.